What would you say to those healthcare workers? You're saying this. You're wearing a mask now indoors. This is the new CDC guidance if you're not in your home. So I think I totally understand why you're doing that now. Yet the White House and the State Department are throwing indoor parties all this month. I mean, as you know, this mixed messaging that the country's been getting, you say one thing, Dr. Fauci says one thing, and the president does another.
I think it's really important that every single person understands that the way this virus is spread is if you're with anyone indoors without a mask, that's a viral spreading opportunity. If you're outdoors and hugging and kissing individuals, that is a viral spreading opportunity. We have to really understand how contagious, how infectious this virus is. And it's really important at this moment in time that everyone understands also how much virus is out there. There isn't a state without increasing cases right now except Hawaii. So this is where we find ourselves, and we have to listen right now to what we know works, which is mask, physical distancing, washing your hands, but not gathering. You cannot gather without mask in any indoor or close outdoor situation.
I don't mean to belabor this point, and I understand your frustration probably as a public health official being asked about what is happening on the political side of things. But the fact of the matter is, we've been through this for 8 months now, and you have given us all these warnings. And again, the president and others in the administration just flout them. And so do you understand why some in the public then say, well, if he doesn't think it's a big deal, I guess maybe he thinks all the health people they're overdoing it. They're overselling it.
You know, I've heard that personally. When I go out, I just don't meet with healthcare providers and governors and mayors, but I also meet with community. And so I hear community members parroting back those situations, parroting back that masks don't work, parroting back that we should work towards herd immunity, parroting back that gatherings don't result in super spreading events. And I think our job is to constantly say those are myths, they are wrong, and you can see the evidence base. And right now, across the Sun Belt, we have governors and mayors who have cases equivalent to what they had in the summertime, yet aren't putting in the same policies and mitigations that they put in the summer that they know changed the course of this pandemic across the South. So it is frustrating because not only do we know what works, governors and mayors use those tools to stem the tide in the spring and the summer. And this fall-winter surge is combining everything that we saw in the spring with everything that we saw in the summer, plus the fall surge going into a winter surge. I think that's why Dr. Redfield made this absolute appeal to the American people. This is not just the worst public health event. This is the worst event that this country will face, not just from a public health side. Yet, we know what behaviors spread the virus, and we know how to change those behaviors to stop spreading the virus.
What states right now